My name is Vincent. I'm originally from Grand Junction, Colorado, which is where I was born and raised. Left there to go to Colorado State University for my undergraduate degree, and actually stayed there for another couple of years to do a master's in anatomy. From there I went to medical school at University of Colorado in Denver, and then did my ophthalmology training at University of Missouri in Kansas City. And after that really wanted to specialize with glaucoma, and so I left to do a fellowship in Baylor College of Medicine in Houston, Texas. And after that, I actually came back to University of Missouri, Kansas City, and joined staff there as an assistant professor, where I not only practiced but got to work with residents and did teaching in both clinic and surgery, and was there for 3 years before ultimately joining Wolfe Clinic. From a very young age, I was always interested in medicine and surgery, having come from really kind of a family of doctors. My father's an oral and maxillofacial surgeon, my older brother's an ER physician. Myself and my younger brother are both physicians as well, and my younger brother's an orthopedic surgeon. But in medical school, I always was drawn to something in surgery, and for a while thought I wanted to be a general surgeon. But as I got introduced to ophthalmology and got more exposure to it, I found that that was a real fit with my personality, and I was really drawn to ophthalmology because of a lot of the optics and lasers and the technology that we get to work with. Glaucoma patients can have a very wide array of both severity and treatment options, and you oftentimes have to tailor the treatment to the patient and not just to the disease. So I find that very rewarding to try to find a good treatment that's going to fit with the patient based on their lifestyle and their understanding and their situation. So I tend to have a philosophy where I like to explain to patients why we're doing what we're doing. And I think if there's better comprehension on the patient's part of what it is we're trying to accomplish, that's going to turn into ultimately better compliance and better outcomes. So I tend to like to explain to patients what's going on and give them my impressions and recommendations, but I also like to involve the patient in that decision-making process. And that is something that I find rewarding within the field of glaucoma. One of the things that really drew me to Wolfe too is the coverage that we have within the different subspecialties. And I find that very helpful to be within a practice where I have colleagues that are experts in retina, experts in corneal diseases and other subspecialties that allow me to really focus on glaucoma and giving the patient the very best from that aspect. And it's helpful to be able to rely on other members of the practice to be able to focus on some of those other issues. I do work with a lot of great optometrists, and I think it's really helpful for me to have that good relationship because nowadays, fortunately in glaucoma in particular, we have a lot of great medications, and many patients really can be well controlled with medications. But as I know all too well, there's often times where medications just aren't enough. And so having a good relationship with optometrists helps for appropriate timing of referrals so that we catch people at a time when we can improve their care and keep them from getting worse. That's one of the scary things about glaucoma is that unfortunately, because glaucoma is nerve damage, any vision we lose from glaucoma is gone. We can't get it back. So having a good relationship with optometrists to be able to work together to catch people and bring about interventions at the right time for what they need is important to keep people's vision healthy and keep them from progressing over time. Having grown up in Colorado, I spent a lot of time outdoors growing up, so I've always enjoyed fishing and some hunting, camping, those types of activities. I've done a lot of whitewater rafting when I was growing up as well. But nowadays with young kids, I like to do a lot of camping and just outdoors things, campfire. Me and my son sometimes go shooting and enjoy that time as well. But love spending time outdoors and love spending time with family as well.